Hi guys, this is Christian speaking. I'm the CEO of Fast Medical AI. I'm here with Mark, who's the COO of Fast Medical AI.
Hey guys.
So we are here to explain how to use our EMS assistant for providers. And the very first thing that we need to do is to log into the system. Um, we made it very simple. So all you have to do is visit our site, which is chat. You want to chat, right? .fastmedical.ai, and that's pretty much it. So chat.fastmedical.ai, and you should see a transition into a login screen, which you can see here, login.fastmedical.ai. You can use any Gmail. If you have Gmail, use Google, right? If you have Google Workspaces like we do, then use Google as well. If you have a Microsoft provider, then use Microsoft. And you won't have to create an account, just it will use that account. Otherwise, you have to create an account, and you will create it with our provider, which is Outras, and that's basically it. So in this case, I have Google, so I'm going to click Google. I'm going to use my Google account. And we're logged in. So this should be the very first screen you see, and mobile as well. The only difference in mobile is that this column on the left is going to be hidden. You can open it with what we call the burger icon, which is usually on the top left. And then once you open it, you'll see a blue icon and a light blue icon. So the dark blue icon is they start a new conversation, and then the light blue is logging out. And Mark, I'll hand it over to you to explain the rest.
All right. All right. Hey guys. So, like Christian said, this is the first screen you're going to see in our chat interface. So, focusing at the top of the screen, on the left-hand side, we have some options there as far as choosing your scope. We're going to leave that on ALS just because we want to show you the full scope of what this thing can do. Off to the right side, you can choose your state. And we're going to leave it on Massachusetts because that's the state that we have fully loaded into the system right now, ready for testing. So at the bottom of the screen in the middle, we can see that we have 4 options there, 4 conversation starters. This is just to give you an idea of what you can ask this thing. It's similar to ChatGPT, how they have conversation starters to try to get you going if you're brand new to the system. Once you get experience with the system, those conversation starters don't matter. It's just for new people. Right below that, we have the text entry box where you can type in your scenario, your question, whatever you want to ask the AI. You can type that in and then hit the send button. Okay, so we'll go through a scenario real quick here where we'll show you the full functionality of the AI. So let's start with I have a 5-year-old female who is experiencing a seizure. This is very straightforward. Family states she has a history of epilepsy. They have already administered Diastat with no effect. All right, we'll go ahead and send that off, and that'll get the AI started on our scenario. You can type into this thing if you want. I think most people are going to be using this on their mobile phone. If we're just testing it, then testing it on a web browser is perfectly fine. Or if you just want general medical knowledge, answer to a question or something. But out in the field, most people will be using this on their phone. I use speech to text. Right now, the functionality of speech to text is going to come from your mobile phone. If you're an Android, it's going to come from your Android. It's usually a little microphone icon on your keyboard. Or if you're using an iPhone, it's going to come from Apple. So that speech to text right now is not from us. So, and it's okay, but I find that I have to enunciate really well. We will be implementing speech to text in the future, something that will be good at recognizing medical terms and spelling them correctly. Right now, the AI is pretty decent, though, about correcting for your spelling with speech to text and figuring out what you're trying to say. All right, so here's our answer. So right off with every answer, the first paragraph is usually a synopsis of what the AI knows about your patient so far, what you've told it so far, and the different things that we've learned. And that's just so you know, can tell that it's paying attention. So based on the information provided, the patient is a 5-year-old female experiencing a seizure despite having a history of epilepsy and receiving Diastat without effect. Cool. The priority in this situation is to ensure the patient's airway is maintained and to consider the potential causes of the seizure, such as low glucose levels or other underlying conditions. Awesome. Given the patient's age, the airway is best managed with a BVM or an SGA. Awesome. That's perfect. That's correct with pediatrics. If the seizure continues and there are signs of respiratory depression, intubation may be required. Monitor the patient's oxygen saturation, heart rate, and blood pressure continuously. Okay, awesome. As the patient has a history of epilepsy, consider potential causes for the seizure, such as inadequate anti-seizure medication levels or non-adherence to the medication regimen. The patient's glucose should be checked per the provided protocol. So this thing knows your protocols, which is really helpful. If the glucose level is less than 70, administer D10. Awesome. Okay, now we're down to what are we going to do about the seizure? Since Diastat has already been administered without effect, they may require additional doses of benzos. Midazolam 0.1 milligrams per kilogram IVIOIM, which is what we give in Massachusetts, to a max single dose of 8 milligrams, or Midazolam 0.2 milligrams per kilogram intranasal to a max dose of 10 milligrams can be considered according to the provided protocol. Okay, so I want you to look at the next to last paragraph. Considering the patient's age and the ALS scope of practice, the administration of epi or nitro may not be directly relevant to this situation. So this is a little bit, so when we give a broad, I just want to kind of point out for a little bit so you can know what to expect. When we talk about hallucinations, that's when the AI says something that we're not expecting or doesn't seem like it fits. Sometimes when the scenario we give the AI, such as I have a 5-year-old female who's having a seizure, and she's got epilepsy. It's still kind of a broad scenario. Sometimes when the scenario is broad, then the answer will be a little broad. However, the AI understands that even though somewhere in the process, the AI came up with something about nitroglycerin or epi or something, the AI caught it and says, okay, considering the patient's age and the ALS scope of practice, the administration of epinephrine or nitro may not be directly relevant to this situation. That's a hallucination. Somewhere in there, the AI came up with nitro or epi, and it caught it and said, hey, this may not be relevant. However, it is essential to be prepared for potential complications during the seizure, such as airway obstruction or cardiovascular compromise, and have the necessary medications or equipment available. So probably, this thing is starting to think, maybe it's possible this kid could go into cardiac arrest, and that's where that came from. In a broad scenario, the AI tries to prepare you for all, possible outcomes. So at the end, it's just a summary, and summary prioritize airway management, assess potential causes of seizure. Cool. So what do we want to do now is we want to give some Versed. So this thing understands midazolam, it understands Versed. So let's say the patient weighs 50 pounds. It's a big 5-year-old. Patient weighs 50 pounds. What is my dosage for Versed? VERSED. All right. And I wanted to show you using a different name other than midazolam so you can see that this thing works. So what this is doing right now behind the scenes, this is our medication. This is one of the functionalities that this thing will do. It'll do medication calculations for you. It's going to convert their patient weight from pounds into kilograms, and then it's going to do it'll do the calculation for you, and it's going to show its work to you. And that's important so that you know it's working properly. Obviously, we have a
Just
little
FYI.
disclaimer at the bottom. The EMS assistant can make, but
There you go.
okay. Am I good?
Yes, that's 0.1 milligrams kilo to a maximum dosage. So calculate, obtain the patient weight, 50, which is 22 kilo. Determine the dosage based on the patient weight, 0.1 kilograms. So calculate the dosage, and yeah, that's correct.
All right. Awesome. So, yeah, and then it gives you a little 3-step process. So you know that it's got the right dosage, and you can have a little confidence in that.
Yeah, so
Cool.
I mean,
2.27
for the
milligrams.
most part, the AI is descripted. We wanted it to be descripted. We created it that way.
Yeah.
This way, because the thing with AI is there will be hallucinations, right? We have minimized them a lot, like a lot. I think we are way ahead on that one, but there's still gonna be some, you know. So if the AI describes what it's doing for you, then you can verify the work.
Exactly. Yep. And so obviously as a provider, I'm going to look at that and say 2.27 milligrams. Okay, I'm going to go with 2 milligrams. You know, this thing is very precise because it's a calculation. I'm going to go with 2 milligrams. So there we go. Let's see. So we give the 2 milligrams. Okay, so let's do a third step here just so you can see kind of a full case. And we can say, okay, I administered Versed 2 milligrams. And the patient, the seizure has stopped. And we'll see what it says here. At the bottom of the screen, I don't think I talked about this yet. You can see oh, there we go. Okay, cool. Thank you for providing the update. No further action is required at this time. Continue monitoring the patient's condition and administer additional care as needed. Okay, cool. That's very helpful. A little encouragement there. I didn't have time to point out the progress bar at the bottom, but we can do something else here so that you can see that there is a progress bar at the bottom that lets you know this thing is working. Okay, so let's see. Do you want to do anything else with this case, Christian, or do you want to move on to something else?
We can do another case.
Okay, let's do another case. Okay, let's start out with, okay, I want to incorporate a case with some general medical knowledge here. Because this thing is, you can ask it all kinds of general medical knowledge questions. Let's pretend that we can actually perform a cricothyrotomy in Massachusetts, even though we definitely cannot. Let's just pretend that we can, because some states out there absolutely can do this, some advanced systems. So let's say I have a 47-year-old male patient who has an upper airway obstruction. We'll go with that. Despite multiple attempts, we have been unable to relieve the obstruction. We want to set this guy up for a cricothyrotomy. Don't put that in there.
We have been unable to
what did I say?
No.
Yeah, relieve the, resolve, relieve, remove, something like that. To resolve the obstruction. Oh, there we go.
See,
all right.
My experience.
Let's send that. All right. Now you can see at the bottom, I want you to look at the progress bar. Now this progress bar lets you know the system is working. If that progress bar isn't there, then the system is not processing your request. Sometimes, just like with ChatGPT, there's a little hiccup and it needs you to resend. Right now, what you have to do is copy your question and repaste it in or retype it. In the future, we're going to have a little button so that you can regenerate a response just like ChatGPT does. All right, so the ultimate goal for this scenario is going to be to show you the power of the general medical knowledge that this thing has. All right, so just like before, based on the information provided, it appears you're dealing with a critical airway situation, and conventional airway management techniques have been unsuccessful. Perfect. The scenario necessitates the implementation of advanced airway management protocols. Okay. Let's see. Given the patient's unstable airway and failure of conventional intubation attempts, I recommend proceeding with a supraglottic airway device insertion, as outlined in the ALS scope of practice and difficult airway protocol. SGA, blah, 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 blah. Cool. So, okay, if the patient cannot be ventilated with the SGA, we're going to go right out there and say, nope, they can't. And if you are properly trained and authorized, consider performing a needle cricothyrotomy or a surgical cricothyrotomy as a last resort. Oh, okay, cool. Well, we don't know how to do this. So, we don't want to just wing it. So we're going to ask this thing, how can I perform, make sure you put in there a surgical cricothyrotomy, because we want the real deal here. Obviously, this is an extreme example that you're not going to use in the field. If you're not trained and already know how to do this, you're not going to ask for instructions on how to do it, in the field so that you can do it, because that's not going to happen. But this is a really good example to show you the power of the general medical knowledge and just what this thing can do. If you're sitting at work or you're sitting at home in your downtime and you want to ask it things to get smarter, you can do that. You can totally do that. All right, so we're working here. It's coming up with our answer. It's kind of a complicated, 12-step process here of performing a surgical cricothyrotomy.
I was gonna say, I was gonna say that this is an actual artificial intelligence that we run. So like, it's thinking. It's actually producing the tokens basically. So
Yep.
So they
And
larger the response, the more time it will take.
yeah. And just to be clear, this has nothing to do with ChatGPT. We refer to ChatGPT because people have used it and they understand it, but this has nothing to do with ChatGPT. This is our own smart medical AI. Okay, so based on the information provided, I will detail the steps for performing a surgical cric, which is typically considered a last resort in managing an airway obstruction. The last sentence, this procedure is within the scope of ALS services and should be performed by a trained personnel. That's a little disclaimer that the AI is telling you to say, hey, idiot, if you don't know how to do this, forget the steps, don't do it. All right, so let's go through it. Number 1, position the patient, place the patient in a supine position, slight head tilt, chin lift, identify your landmarks, locate the cricothyroid membrane, which is a depression between the thyroid cartilage, Adam's apple, and the cricoid cartilage. Prepare equipment, gather a number 10 scalpel blade. Here we go, baby. A tracheal hook, which is apparently optional, and a tracheostomy tube or a large bore IV catheter. Ugh. Perform vertical incision. Make a 1 to 2 centimeter vertical incision through the skin and cric membrane using the number 10 scalpel blade. Good luck. Blunt dissection, optional. If using a tracheal hook, insert it into the incision. Apply a gentle downward traction. Wow. So this thing has a 9-step process. Insert the trach tube or IV catheter, secure the device, continuously monitor the patient's vital signs. Hopefully you didn't kill them. Communicate with med control regarding the procedure and the patient's response. Yes. Has this worked? All right, so last paragraph is a little sum. Considering the conversation history and current query, the patient's upper obstruction has been proven resistant to other interventions. Performing a surgical cric is appropriate in this context, given the patient's critical condition and the failure of previous attempts. Continuous monitoring of vital signs, communication with med control is essential, and after the procedure, so that med control can tell you not to do it if you haven't been trained. Okay, but so sitting at work or in our downtime, we can ask this thing's question, and you can ask it, how do I find the cricothyroid membrane? And it will give you a several step process in how to find and palpate the cricothyroid membrane. This thing has all kinds of things that it can answer for you.